More than 1 in 5 adults live with a mental illness in this country. For children, that number is 1 in 6, often going unchecked and untreated, if not for anything other than a lack of resources. That has just changed in the Lowcountry. Let's welcome Melissa Camp, Director of Clinical Operations for Live Oak Mental Health and Wellness. It's good to have you. Thank you. And this is quite momentous. You opened just a couple of weeks ago. And why is this such a momentous occasion?
This is a huge resource for our community as a whole. So this hospital specifically for South Carolina is the first one to open in over 30 years.
Wow, in over 3 decades. So why now?
I think the need is there, and this is really a huge investment on the part of Trident in the community of Charleston and South Carolina as a whole, because we will have patients from all over the state. Mm-hmm. There's just a huge need. We have a lot of people that the beds are full at other hospitals, and a lot of people that are out there needing this level of care. Do
you have the professionals necessary to help these patients? I'm saying before this hospital even opened, you were saying that the hospitals were quite busy, but did they have enough professionals even to come to the aid of these patients?
I think for the most part, I mean, obviously COVID threw everybody for a loop, and nursing needs across the country were well known, but in this field, I think that we were doing well with having professionals, but there just weren't the spaces for them to be in. And so Trident had an inpatient behavioral health unit, but much smaller, that was fully staffed.
Okay.
There just weren't enough resources to be able to treat the patients.
Right. So this is a 60-bed facility, but you treat both inpatient and outpatient. And what are the ages of whom you treat?
So the way the facility is set up, those 60 beds are divided. There are 2 units that are routine adult units. There's a unit that is 55 and older. And then coming in August, we'll open the adolescent unit, which is ages 12 to 17.
Oh, so you are going to be helping adolescents, so people who are under the age of 18, for instance. And what are some of the disorders, the mental disorders that you're going to be treating there?
So predominantly, we see a wide range, but a lot of folks that are struggling with depression, anxiety, maybe PTSD, bipolar disorder, as well as individuals with things like schizophrenia.
Okay, so things like developmental issues, not necessarily something that one would come to you for?
Right, that wouldn't be the primary focus. There might be some folks that have co-occurring disorders, but that wouldn't be the primary focus of the treatment. And
you mentioned adolescents' behavioral issues. Is that also addressed there, or is that something that you would treat separately elsewhere?
Well, I think yes and no. With the kids, they show what's going on with them a lot differently sometimes than adults. They don't always have the words for it. So I think oftentimes, even if it's anxiety or depression, it might show itself. It often shows itself in behavioral ways.
Yeah. So. Does one have to get referred to your hospital in order to get help, or is this some place where one could just call you up and say, I need help, or I have a family member who needs your help, and they just come and make an appointment with you?
So all of those routes are available.
Okay.
So some people come to us through a lot of different avenues. Some are at our local emergency departments and are referred to us. Some are with private providers. Maybe they're going to see their psychiatrist that they normally see and need an increased level of care. But also we have a phone number and a website where they can go and sign up for an assessment appointment online on the website.
Okay, and I imagine under certain circumstances insurance may cover this, but is this out of pocket usually? How does one pay for this type of treatment?
So if somebody has insurance, then we're going to bill that insurance. And for the inpatient services, we don't differentiate. For all of it, we don't differentiate necessarily based on ability to pay. I think it just gets tricky on the outpatient side, what insurances will pay and won't pay, and we don't want to create a financial burden for somebody, right? But on the inpatient side of things, that's an emergency medical need. And so regardless of somebody's ability to pay, we're going to get them the care that they need, for sure.
And voluntary versus involuntary, do you take both?
Both.
Okay. So, and this could run the gamut from someone referring a family member or a friend to perhaps someone who's homeless, who finds themselves without any familial resources.
Right.
Okay. I imagine that things will get quite busy for you, especially as you move towards August and you start accepting more patients, the younger patients. But for anybody who wants more information on how to obtain your services, where should they go?
So they can go to our website, or they can call to our intake team.
Okay.
And we can help them kind of problem solve and sort through what's needed.
Melissa Camp, thank you so much. Appreciate that. We're going to put the information up on the screen. We're back in 2 minutes.